you will go for further imaging. Sometimes you think there is multiple lesions there, so you need to see all together. Then you will go for panoramic radiograph, not going for periapical radiographs. Maybe for periapical radiograph will not give you the exact size and shape of the lesion. Or sometimes you have done this periapical radiograph, then you saw this one, the whole periapical lesion is not covered with this periapical radiograph, or the generalized bone loss, periodontal bone loss. Then you need to go for panoramic radiograph. Or sometimes there is a patient with TM joint dislocation or disc dislocation. Then you need to go for MRI to see this one, because for MDCT or CT you cannot see the disc dislocation. So depending upon your clinical examination and history of the patient, you will go for radiograph. So as we mentioned, one of the most effective means of reducing possible harm, because there is no limitation, or there is radiation biology or radiation effect or radiological effect or ionizing radiation. So it is always recommended to have as low or as less you can expose the patient towards the radiograph. So suppose once you have taken one periapical radiograph, but you want to see only the carious lesion, but there is a cone cut, or but there is some vertical angulation or horizontal angulation was not proper. But whatever the information you want to gather, you can see this from images. So you don't need to expose. Ideally, you should expose this patient again to have a better radiograph. But if you have, you can gather the information, valuable information, what you needed. So you don't need to take the patient radiograph again. So the decision to make radiograph exams are prevalence of disease that may detect the radiograph. So what type of disease you want to see, or what are the types of disease, and which one is the best possible radiograph for this disease, and suppose for caries or periodontal disease. To see the carious lesion, which is the most common, caries and periodontal disease. Maybe 80 to 90% of your cases will be the carious patient or periodontal disease. You will go for simple periapical or bite-wing radiograph. Bite-wing radiograph will give you the best possible resolution and density or clear image, fine details of the carious lesion for obviously the posterior teeth. For anterior teeth, you will go for periapical radiograph. Periodontal disease, if it is generalized, you will go for panoramic radiograph. Or if it is localized, if there is posterior teeth, you may go for vertical bite-wing radiographs. So also it depends upon your ability to how to read these images. Okay. So, as I always mention to my students, that to determine the abnormality, you should know the normal anatomy first. If you don't know the normal anatomy, you cannot determine that whether it is abnormal or not. So, I always give this advice to my student that whatever radiograph you have taken, suppose this is only for a periapical lesion or only for a carious lesion, but try to identify all the normal anatomy on that radiograph, because each human being are different. Their anatomy are different. So sometimes you will see mental foramen opening in the just below the 4-4 or 3-4. Just a periapical area. Sometimes it will be mesial or distal to the 4-4 or 3-4. So depending upon the ability of this clinician, the clinical examination and radiographic evidence will guide you to understand. So sometimes there is also fear of consequence, undetected disease or untreated disease. Sometimes you miss some diseases if you don't know the normal anatomy. Sometimes you only focus on the patient chief complaint, but sometimes there are some hidden diseases. So you should know there is the normal anatomy so that you can detect and always carefully examine the whole radiograph. Okay, so that you don't miss any information which will be beneficial for the patient obviously and for you also. Even if sometimes you miss some diseases, sometimes patient will not may come to you again. So it is very important to detect all the diseases in the radiographs. Sometimes there are the deep caries. Sometimes we miss this one, or sometimes there is recurrent caries. So patient is complaining, but we cannot determine. So you should be very careful while reading these radiographs. So American Dental Association selected the criteria of prescribing this dental radiograph. If you have this positive historical findings, suppose any previous history of periodontal or endo treatment, history of any pain or trauma, family history of anomalies, or some post-operative treatment, healing, and monitoring of the disease, or if there is any nowadays implant are very common, and after placement of implant we need to see whether this is we need to assess whether the bone formation around the implant is good or not, the healing of the implant. So these are the positive historical findings and some clinical signs and symptoms when you should go for positively you will go for radiographs. So periodontal disease, most common, carious lesion, deep carious lesion, restorations, clinically malposed or clinically impacted teeth, if there is any swelling, trauma, mobility, sinus, and sometimes any abnormalities, growth abnormalities. Sometimes there are some systemic diseases and some neurological findings. And if there is any road traffic accident, which is very common here, sometimes there is foreign objects embedded in the soft tissue. So you need to go for that kind of imaging, TM joint, facial asymmetry, and all this. And implant, peri-implantitis, and everything. You will go, if you go through this chart, you will get everything. So these are the most common things for which cases you will send this patient for radiographs. So our general dental goal of dentistry is to preserve and improve the patient oral health while minimizing their health-related risk. Okay, so even if radiographs are benefit to the patient, the exam does not carry the potential harm from the patient exposed to ionizing radiation. So always think about, I'm telling again and again that you need to also think about the ionizing radiation. Except MRI, all these dental radiographs are ionizing radiation, from periapical radiograph to panoramic and MDCT, CT, CBCT. So even if it is beneficial for the patient, but there is also a risk of ionizing radiation. So you need to balance between them. So you need to risk versus benefit. Which one is necessary for you, and which one you cannot? You can do it with seeing the previous radiograph. You will determine. It depends upon solely upon you. So there are different types of radiographs. We know And in different condition, you will go for different types of radiograph depending upon your infrastructure.